When things wear out, it's sometimes best to switch tactics. When large fillings wear out, it's sometimes best to switch to a crown, because a crown covers and protects a damaged tooth. A filling doesn't. Let's take a look at some worn fillings. The edges of these small fillings have broken, and they've lost their seal. Since most of the tooth is still intact, it's safe to replace them with new fillings. It's a different story for large fillings. From a top view, a filling like this doesn't look too bad. But from a side view, you can see that there's hardly any tooth structure left to keep the tooth from breaking. After a tooth breaks, it's much more difficult to repair. Switching to a crown when a large filling has worn out protects you and strengthens your tooth. It takes 2 appointments to restore your tooth with a crown. That's because a crown is custom crafted in a dental laboratory to precisely fit your tooth. We want the entire procedure of getting a crown to be comfortable for you. So the first thing we do is make sure you're thoroughly numb. Then we remove any decay and shape the tooth with the handpiece. Sometimes, to help us make a more accurate impression, we put a small piece of string in the space between the tooth and the gum. This gently pushes the gums away from the tooth. Impressions give us an accurate working model of your mouth, including the prepared tooth. This lets us recreate your natural bite. For the week or two that it takes the dental lab to fabricate your new crown, you'll have a temporary crown in your mouth. At your next visit, we remove the temporary crown and try in your new crown. We check the fit and your bite. When everything looks good, we cement it in place and you'll have a new porcelain crown.